Greetings, weekly listeners. Emma and I are so happy to have y'all back.
Yes, we're live from our listeners' favorite coffee shop. Welcome back to the Sunshine Podcast, where we shed light on heated topics. Marissa, how are you doing today?
I am so pleased to be back in the coffee shop to record because it feels like our holiday break was forever.
Make sure to use the hashtag #TheSunshinePodcast to send in your live questions and to be featured on our show.
We'll be answering your questions in a short amount of time, so make sure to call in soon. We know you guys have missed us during our holiday hiatus, but we are back and better than ever.
Yes, we have big plans for the new year, and we can't wait for you guys to listen.
As you all know, each week we pick a mental illness and focus on ending the stigma surrounding it. We really strive to make sure our listeners are well-rounded and properly educated individuals.
We have such an interesting topic to discuss. We have listened to all your requests, and we're going to be talking about ADHD.
Yes, we know what you're thinking. It is a disorder in which people get distracted and don't have a large attention span. But it is so much more than that, and we want to end the stigma. Now, before we ramble on about what you think you should know about ADHD, we want to hear what you guys want to know.
Let's talk about the actual definition of ADHD. According to our highly credible source, the Diagnostic and Statistical Manual of Mental Disorders, it states ADHD is a neurodevelopmental disorder defined by impairing levels of inattention, disorganization, and/or hyperactivity impulsivity. Inattention and disorganization entail inability to stay on task, seeming not to listen, and losing materials at levels that are inconsistent with age or developmental level. Hyperactivity impulsivity entails overactivity, fidgeting, inability to stay seated, intruding into other people's activities, and inability to wait, symptoms that are excessive for age or developmental level. Now, it's time to get to the real business. Right now, dial on your cell phone 555 to have a chance to be broadcasted on our show.
We have our first caller, Elena from Georgia. What is your question?
Hi, I love your podcast and I tune in every week. I was so excited to hear that you guys would be talking about ADHD because I'm afraid my son Michele might have it. Now, I'm not trying to make a negative connotation surrounding ADHD, but I just want him to be perfectly healthy. Down here in the South, I homeschool little Michele, and I've noticed his attention being hindered when I try to get him to sit down and take a test. What can I do? What does this mean? What would cause something like this behavior? He's only 8, and I've never experienced anything like this with my other children at his age.
That is an excellent question. I feel that because this type of behavior is not far from the norm of someone his age, and as their brains are slowly developing, it can be challenging to get them to be fully engaged in academically vigorous activities, although it is something that should be carefully monitored and considered.
Yes, definitely. Attention deficit behaviors are very common amongst his age group, but also in adults. According to the credible source titled The Healthline, it statistically reports that the average age of ADHD diagnosis is actually 7 years old. Symptoms of ADHD typically first appear between the ages of 3 and 6. ADHD isn't just a childhood disorder. About 4% of American adults over the age of 18 deal with ADHD on a daily basis. Some of the possible causes could include both inherited and environmental factors, poor parenting, brain damage due to head trauma, infection, too much sugar, and exposure to alcohol or lead. Here is also a significant stat that's noted from the Britannia database. About 40% of children with the condition have a parent who has ADHD, and 35% have a sibling who is affected. About 15% of persons with ADHD appear to carry chromosomal abnormalities known as copy number variants. These defects consist of deletions and duplications of segments of chromosomes have been implicated in other disorders, including autism and schizophrenia.
Now, to all our listeners, we are obviously not able to diagnose just through listening to your questions and personal anecdotes. However, we are able to provide our advice and knowledge.
Yes, in order to get a more accurate depiction, we would need to do several tests where we would study this type of behavior of the individual for a certain duration of time.
Some other symptoms could include daydreaming a lot, forgetting or losing things a lot, squirming or fidgeting, talking too much, making careless mistakes or taking unnecessary risks, having a hard time resisting temptation, having trouble taking turns, having difficulty getting along with others, and the list could go on. Elena, does this clear any confusion?
Yes, I thoroughly appreciate it. I feel so much more informed. Now, is there anything I could do to help my son?
Yes, there are several things you can do going forward to try and help him.
It's a good idea to try and create a routine for him to stick to. This will create structure and it'll help him to focus more on the things he actually has to get done.
Now, it'll help if you try to simplify and organize his routine as well. Since he's homeschooled, it'll be much easier for him to have a quiet space and time for himself so he doesn't get as distracted.
While your encouragement and dedication to helping your child is important, it may be a good idea to get him professional help, such as a therapist, so he has an outlet. If it ever gets too overwhelming, it may be a good idea for you yourself to have an outlet, like a support group or a therapist as well.
So helpful. Thank you so much for the input.
ADHD can be really overwhelming to deal with, especially in a hyper young child like Michaela.
Okay, now time for our science fact of the day featuring ADHD.
Now, anatomically speaking, Britannica notes another study showed that an area of the prefrontal cortex known as the left anterior frontal lobe metabolizes less glucose in adults with ADHD, an indication that this area may be less active than in those without ADHD.
Yes, despite ADHD being a behavioral illness, medical professionals are able to perform medical examinations that can directly correlate areas in the brain that are expressing signs of ADHD other than solely performing behavioral analysis. This provides more clarity towards a diagnosis. ADHD can't be diagnosed by a physical test, such as a blood test, but a couple years ago, a new way to diagnose was approved.
Yes. Did our listeners know that in 2013, the FDA approved the use of electroencephalogram EEGs to diagnose ADHD? This test helps to scan the brain waves and irregularities.
Okay, now you can call 555 and we'll be taking a couple more questions.
That was fast. Our next listener is Raquel from Montana.
Wow, I really can't believe I was a selected caller. I love listening and learning on my way to work. Now my question is, what are the different types of ADHD?
That is a very great question. Like we previously mentioned, people typically hear ADHD and think, okay, that is people who can't focus. But realistically, there are different levels and types of ADHD one can have.
Yes, exactly. It is a little more elaborate than the media likes to express.
There are three main subtypes of ADHD: hyperactive impulsive, predominantly inattentive, and lastly, around 60% of people with ADHD have the combination type of the two levels above.
So to elaborate on each, hyperactive impulsive means you have increased movement and you're restless. This includes fidgeting and squirming, and it's basically difficult for one to sit still. However, with predominantly inattentive ADHD, one has often trouble keeping focus. It's hard for them to finish tasks because they tend to procrastinate and are very forgetful. And for the combination type, you demonstrate 6 or more types of hyperactivity and then 6 or more types of inattention.
Okay, so to go off of that, how does one get diagnosed with ADHD or a specific type?
Many young kids are hyper, but that doesn't necessarily mean they have ADHD. Many healthcare professionals such as psychologists, pediatricians, psychiatrists, etc. can diagnose a child with ADHD. If you are an adult and you want to be evaluated for ADHD, you'll most likely have to give background on your behavior in your early years or from your childhood.
Being diagnosed with ADHD can help you make sense of your life and even past decisions. Every case is different, so you may have to discuss treatment options for it as well. Thanks for the questions, Raquel. Now it's time for our fun fact of the day.
What is it?
Did our listeners know that an influential multi-gold medalist opened up about her experiences with ADHD?
Wow, that's so interesting. I didn't even know that.
Olympic gymnast Simone Biles. Going through something like this in front of the public eye can be really challenging, but she expressed her experiences to the media to aid as a role model for those who are struggling.
That is so fascinating. Did her mental illness affect her gymnastics abilities?
Yes, it became a very controversial topic when Russian hackers broke into the World Anti-Doping Agency and discovered that she was taking medication to help with her ADHD, and some felt that it shouldn't be allowed in the Olympics and tried to imply that she was doping.
Wow, that's insane. What specific medication was she taking?
Apparently, she was taking methylphenidate, which is otherwise known as Ritalin. It's a stimulant, and people thought that she was using it to cheat in the 2016 Rio Olympics. She later revealed to Twitter saying, "I have ADHD and I've taken medicine since I was a kid. Please know that I believe in clean sport and have always followed the rules and will continue to do so, as fair play is critical to sport and is very important to me."
I understand the viewer's perspective because ADHD medications like Adderall, especially for college-age kids, are one of the most abused drugs.
Yes, unfortunately, people sell Adderall illegally for the beneficial side effects such as loss of appetite and increased attention span, for people to be able to do work in half the time. It was later revealed that Biles was approved for the use of medication through a therapeutic exception.
No one should be penalized for having a mental illness. By taking that medication, it helps her brain chemicals work better, and that's not something to be ashamed of. Some other celebrities that opened up about their experiences with ADHD are the swimmer Michael Phelps. He was in the Olympics, as most of you know. He said he was diagnosed at the age of 9, and it was because of his lack of attention span in school that he resorted to swimming to relieve that stress. Next, Justin Timberlake revealed to the media that he has both OCD and ADHD, and says it becomes very challenging to work in a stereotypical work environment, like a 9-to-5 job, and therefore, singing has allowed him that flexibility with work. Finally, Super Bowl champ and TV sports commentator Terry Bradshaw expressed his struggles with ADHD and how it hindered his academics, and therefore relied on sports. He is now an author and motivational speaker.
Now, Marissa, doesn't it make it feel so comfortable to know that people we can all look up to are experiencing and dealing with something we may all be struggling with?
Yes, so many people have ADHD, but sometimes you just simply can't tell. There's been a 42% increase in diagnosis over the past 8 years, which is just so crazy to think about. Now let's switch gears and quickly talk about some of the other forms of treatments.
Okay, so as we previously stated, some common medications used to treat ADHD include methylphenidate, which is otherwise known as Ritalin. This increases the amount and activity of the neurotransmitter norepinephrine. Next, we have Adderall, which consists of mixed salts of amphetamine. It helps with concentration, increases self-confidence, and reduces temperamental issues. And lastly, we have atomexine, which increases the number of neurotransmitters available in the brain.
Okay, so some forms of therapy that are used for ADHD, there's behavioral therapy, utilized to teach individuals to learn to motor their emotions. There's also mind nerve therapy. So those who are unable to take medications utilize this therapy that includes low-level electronic pulses to stimulate the trigeminal nerve, resulting in increased activity in the brain areas implicated in the regulation of attention and behavior.
It has been observed that ADHD medications and therapies have had an immensely positive effect on treating ADHD. In fact, these treatments have been said to improve ADHD symptoms in about 70% of adults and 70 to 80% of children.
Wow, it's so good to hear when medications and therapies have such high effective rates.
Yes, we have to remember how common ADHD is and how necessary these medications are. According to the CDC, it states 388,000 children aged 2 to 5-year-olds are dealing with ADHD, 2.4 million children aged 6 to 11, 3.3 million children aged 12 to 17 and are dealing with ADHD, and boys are more likely to be diagnosed with ADHD than girls. 12.9% compared to 5.6%. Now, according to our live chat, some people are asking how ADHD affects people's lives and relationships and how they can support someone with ADHD. Marissa, how can they?
Wow, that's a great question. I'll be happy to answer. Well, for starters, people with ADHD tend to experience a lack of self-esteem, and therefore, one can support someone with ADHD by uplifting their confidence, giving them compliments, or just praising them for things in general.
Yes, definitely. Good points. ADHD can affect people's lives and relationships also by having great open communications. In fact, it was referenced by the Psych Central that people with ADHD sometimes have trouble deciphering and processing what people are saying. Also, you can consider your behaviors. It has been noted that people with ADHD can see their symptoms intensify as a result of other people's actions. So now we want to thank you for sending in your questions and hope we could end the stigma surrounding ADHD.
Yes. Now we want you to remember that with any mental illness, there is so much more to it than what the media states. So we really want to enforce taking the time to properly educate ourselves on these topics.
Definitely. Now we are going to send you guys off with our topic for next week.
I'm so excited. So next week we're going to discuss OCD. So send your questions to us on Twitter with the hashtag #TheSunshinePodcast.
See you next week. Bye.